Professor Medina about the value of microvascular Doppler in the assessment of hyaline cartilage, especially in cases of rheumatoid arthritis. Microvascular.
Yeah, there are some papers about the use of microvascular imaging to detect very neovascularization inside the synovium. About the cartilage, there are not papers dedicated on cartilage. There are on synovium. But, for example, in the Achilles tendon, we know that the microvascularization from the cartilage-bone interface goes inside the cartilage as well. So, in that way, we could use that kind of technology to be able to assess these vessels easier. But of course, as you know, this technology is in top range machines. So you need to have the top range machine of each brand to be able to assess MVI.
Because I have seen some cases this modality of microvascular rheumatoid arthritis, and there is very vascularity in the particular cartilage which you wouldn't see by any other medium.
Yes.
This is, I think, due to invasion by the paras.
Yes, it is invasion. Yes, it is invasion from the bone to the cartilage, as I showed in the image. Yeah.
Thank you very much. Question for Professor.
لا ده انا عايز اشكر دكتوره ريني جدا على البرزنتيشن، كانت نايس ميتيكولاس ديتيل. بس عشان الجزء بتاع الفينجرز والتروماتيك اند بيونت وهاي ريزوليوشن ايمجنج كنت عايز يعني شويه ديتيلز عن الالترا ساوند. ان شاء الله بقى خليك
عشان الوقت ما كانش هيكفي.
الوقت انا عارف
فعشان كده
انت عملتي يعني الجزء بتاع
ركزت على الام ار اي، بس ذكرت طبعا ان الالترا ساوند والدايناميك اسسمنت لا غنى عنه طبعا، لا غنى عنه طبعا. او
and frequently asked.
اكيد اكيد.
يعني the title should include MRI because I was expecting ultrasound.
Yes.
يعني انا
Not high
Your
resolution
diagnosis was high
MRI
resolution without MRI. I was expecting ultrasound.
تمام.
So please add MRI to the diagnosis.
اوكي
خلي
تمام.
الالترا ساوند المره الجايه بقى.
اوكي حاضر هعدل التايب.
عندي سؤال يا دكتورة منار. How to differentiate between the sternoclavicular joint is very difficult. It's not that joint you can see much in our practice. How to differentiate between arthritis or inflammatory? If there is a pain and tenderness, is it inflammatory or septic arthritis?
Or inflammatory or septic arthritis?
Yes, septic arthritis, a very dangerous situation, a scenario.
Yes.
But arthritis is easy.
It's usually arthritis, it comes with age. If it's osteoarthritis or degenerative, the clinical setting is very important. If the patient known to have rheumatoid, so have to think of rheumatoid. But if it is painful swelling and acute onset without history of trauma, so most probably it is infective arthritis or septic arthritis. And it's not that uncommon from what I read. It can be because it can come from hematogenous spread that just like any part of the body, and or continuous from any infection, patient with midline sternotomy, or so it is quite present. I mean.
No, I ask you because the management here is very, very aggressive.
Yes.
The percentage of septic arthritis and sternoclavicular joints, 1%, while inflammatory arthritis, due to any cause, 99%. For most of the patients, if there's a pain, tenderness, and swelling in early stage, you cannot differentiate. Do close follow-up.
Yes, but it's acute. Acute, you should think of sternoclavicular.
Presentation and the history is very important.
I think the clinical